Well, good morning, everyone. Welcome. They say you should never perform with animals and children, but obviously you should add poets to that list now. It's obviously, after that wonderful introduction, then you've got the more mundane me. But it's an opportunity for me to say, but I've actually not seen him since, what a wonderful way that Tony's words helped this city recover from that awful one. Those words give us resilience, gave us pride, gave us hope. And we all appreciate that, Tony. Obviously, we hope the book, which has such a great course, does really well, and even I'll buy a copy. It's always inspiring for me as well to be here at Old Trafford Cricket Ground. I can remember coming here as a kid, watching the fantastic Brian Statham bowl for Lancashire, and I was privileged to be here watching England-Australia, the first match that Sean Wayne played in England, and he bowled the world's most impossible ball to bowl Mike Getting. Nobody quite knew how he hit the wickets. And weather today looks typical for an Old Trafford day, doesn't it? Perhaps the ball would be moving if Jimmy Anderson was out there, but it's great to be here. So I'm here, as Tony said, I'm the chairman of the Greater Manchester Health and Social Care Partnership for Wills, and it is a privilege for me to work with so many colleagues on this part of devolution. I'm also probably here, if you look at me, I'm representing the more elderly of the population of Greater Manchester these days, and I do have a device that might beep in case there's a problem, so I hope we don't. So the electrical problems that Vicky had over there, so I'm hoping it keeps going. It's great to have a good conference, but I think maybe next time, John, we need to maybe reflect the communities of Greater Manchester a bit better than we're doing today in terms of the balance of our speakers, but I'm sure we can get that right. This is our first. So devolution. Health isn't the only thing that's been devolved to Greater Manchester. It's been a journey, a process we've been on for a number of years. And we managed to persuade the then government with George Osborne to give us a number of powers for moving forward in Greater Manchester, taking powers from central government and exercising them here in Greater Manchester on behalf of people, doing things that people in Greater Manchester felt were important, not what civil servants in Whitehall think were important. And that was it. And there was a throwaway line in that agreement at the end of 2014 that said, we'll look at health and social care. And thanks really to one man, to Sir Howard Bernstein, for the work he put in to actually make that a reality. By February, we had the Memorandum of Understanding, and we began to work on health devolution for GM. And of course, as probably Andy will tell you, we're ambitious here. Health's a really important thing. It's a lot of money. It's really important. But what we need to do is not think we haven't finished with devolution. There are more powers we need, and particularly powers to make sure we can do things which affect people in Greater Manchester. Because I'm sure, as we'll learn today, health, important as this, it doesn't exist in a vacuum. All of the issues around health are affected in social ways. And I'm often asked by other people in local government, why the hell did you get involved in health? It's risky. They say, if the government's taking money out, you'll get the blame. Why do you do it? Let's just keep away from it. But we do it in Greater Manchester because we believe that we ought to control people's lives. We ought to be able to help to improve it. But I just want to throw one set of stats at you just to show you why I think it's important. The concept of healthy life expectancy. How long can people expect to live on average without needing a great deal of support from health? The average in England is about 63.4 years for men, 64 for women. If you were in the Prime Minister's constituency of Windsor and Maidenhead, it would be 70.5 for men and 70.7 for women. But if you look at the city of Manchester, it's 56.1 for men. And remarkably, 54.4 for women. It's one of the few places where women's health is worse than men's health. So with those stats, we all, I think, have a duty, we all have a responsibility to think, how can we change that? How can we make this a healthier place? And it's in part working to get a better health service, But it's got to be more than that. It's got to be reforming the way we deliver social services, the way we deliver all our public services to enable us to meet that need. So I recently had an experience as a service user. I was in hospital for a fortunately short day. I'm not sure if my consultant's in here today, but he said might. And really, it's interesting, is that you can go to meetings, you understand, but actually if you're a service user, you see things how they really are. And what I took away from that brief was what a wonderful staff the NHS have, the dedication, the professionalism, the hard work. We're dealing with patients, many of whom don't just have, as you know, physical health problems, but as the population gets elderly, they have dementia as well. And they're having to cope with that, and they do it in a way, keep cheerful, keep going, and so on. So it was an eye-opener for me. The other thing was actually to experience what being a patient is like. And I'd walked into the ward, 9 o'clock in the morning, carrying my bag, as I was told to do. Sat down. Anyway, by 10:30, somebody decided I needed an x-ray. But I'm a patient now. I'm not a human being anymore. I'm a patient. So I can't walk to x-ray. I have to have a wheelchair, be pushed with a nurse accompanying me. So we do this little journey, and it was fine, wasn't too long in x-ray, but by the time I'd come out of the actual x-ray thing, of course, the port had been called to some other part of the hospital, so the nurse and I were trapped in x-ray until somebody could come. And it is actually, I don't know, maybe we are a bit too risk-averse. I understand what is about there, but you know, we need maybe to actually profile patients to see if they can walk a bit, and it may be even good for them actually to do a bit more walking than just sit here around. But it's been a really interesting journey over the last 18 months or so. We've had the Health Partnership Board. I think we all think about our own organisations, I think, as we go to those meetings, but I think there's been a lot of collective spirit design. We've done important things on mental health, on physical health, going in Manchester on the move. We've actually done a lot of things which you'll be hearing the detail of today, which are positive. But we know we're on a journey. We know we've got lots more to do as a Health Partnership Board. And I know, as a politician, both health and social care need more money. They need more finances. But what I have learned, if anything, over the 18 months is money alone is not going to be enough. We need to change the way we deliver health, we deliver social care, we deliver public services over the next few years. Make it fit for the 21st century. It was a wonderful invention by Nye Bevan almost 70 years ago now, but we do need to bring it up, and obviously the issues that Nye was looking at in 48 were very different from the health issues that we've got today. So we know we need to change the way we do it. So I'm sure we have lots of examples today of that, and I look forward to listening to the rest of them. Thank you very much.